Say R.
It's something we all have to endure every now and again, but getting access to the dentist's chair is becoming harder and harder. There just isn't enough money or enough dentists to treat everyone on the NHS.
I honestly believe we've gone past the crisis point, and I actually feel that we're potentially in a terminal slide, and I think it can happen very, very quickly.
Finn says the entire system of NHS dental care in this country is broken. Targets are not being met, recruitment is far too low, and dentists are not being paid enough for the work they do. Many are choosing to either go private or walk away altogether. But at his practice in Lostwithiel, Finn thinks he may have found a way forward.
We've not been given any extra funding, but we've been allowed to be more flexible in our approach to how we provide the care. 20% of our budget is going to be directed to urgent care for anyone in the public who has not got access to a dentist and has an emergency. 50% of our contract will be for new patients who have never had access to a dentist, but then they will be let go off the list again. They won't be retained by us. And 30% of our budget is to look after a cohort of our patients who are considered to be the most vulnerable and would be a priority group.
That priority group includes under 18s, over 80s, or those with specific health needs. Everyone else, more than 4,500 existing patients in Lostwithiel, will have to go elsewhere for routine treatment or pay to go private.
This is something that I don't want to do, but I have to do it for the good of the profession. What I can reassure those patients is that if they have dental problems, they will still be seen. They just don't have access to the routine care that they enjoyed. And in an ideal system, everyone should have access to routine care as well. But when the system isn't working, we have to meet the needs of the most needy first, and then we have to work backwards from there.
The pilot project has the backing of Cornwall's Integrated Care Board, which sets the county's overall health strategy.
A lot of dentists are leaving the NHS, so this was something that we felt we needed to support, which was to find a different way of providing dental care that targeted more of a community approach that makes sure that we addressed where the need was the greatest.
The pilot project starts next week and will run initially for 2 years. Sam Blackledge, ITV News.